It is Wellness Wednesday. Today in the sponsor segment, we are talking to Dr. Jeanie Cote. She's a neurologist at Memorial Healthcare's Institute for Neuroscience, who is here to talk about how perimenopause and menopause affect women with multiple sclerosis. Good morning.
Good morning.
Yes, first off, why is this topic of concern for you specifically?
Well, the MS population is aging, and with that it means more patients are affected by perimenopause and menopause.
So what are you seeing then? Are you seeing this firsthand?
Oh yeah, so the symptoms of menopause and perimenopause often mimic MS symptoms. And so patients will come in experiencing more fatigue, depression, anxiety, cognitive fogginess, and wonder if their MS is getting worse, and it actually represents perimenopause and menopause. And so there can be a lot of confusion about, is this MS or something different altogether?
So a little crossover there.
Oh,
so
absolutely.
What is the challenge for you then as a neurologist to kind of diagnose this?
So we really want to know what's happening to the patient, both so that we know, do we need to change how we're treating the MS, but also how do we get better symptom improvement and quality of life for the patient? How do we really address what's going on, what's driving these changes, so that we know how to really manage and get them better control and better quality of life, because the treatment is really different.
Yeah, so once you are kind of diving into those symptoms, let's talk about those treatment options then for women going through these experiences. What are those options now?
Yeah, so thankfully we've come a long way understanding how to support women going through perimenopause and menopause, and one of the treatments actually is hormone replacement therapy. And so for this, we'll partner with our OB and primary care colleagues. Both are wonderful at Memorial Healthcare. So we'll work with them to determine what's the right combinations and who are the correct patients that can receive this. But that can make a big difference managing some of those symptoms.
So a bit of a team effort there.
Yes,
in treatment. So overall then, what advice would you give women then who may be experiencing some of these symptoms? Talk to your doctor, right?
Always. You may think that symptom may not be appropriate for us to hear, but we want to hear. Sometimes patients will think, I might not be interested in knowing about their bladder because I'm a neurologist, but I do want to hear about it because it may be for me to help them with. So don't always assume we don't want to hear, we want to know. So whatever it is, bring it to us, and even if it's not for us to manage, we may know who's best to help you.
Yes, you will send patients in the right direction,
Yes,
right?
Absolutely.
Yes, and overall this is about just improving quality of life, right?
Quality of life and open communication and really just teamwork.
Well, you are in some good hands, and we appreciate your insight this morning. We do appreciate that. For more information on Memorial Healthcare Institute for Neuroscience, you can go to that website that you see there on your screen. And again, thank you so much for your expertise.
Anytime.